Welcome to this presentation on COVID-19 safety guidance for New Mexico transit agencies, provided by the New Mexico Department of Transportation, Transit and Rail Division. My name is Reem Lazaro. I'm a transit safety contractor to the New Mexico Department of Transportation and the narrator for this presentation. For the next half hour, we will discuss some information that can help keep people safe from COVID-19 and prevent the spread of the virus. COVID-19, an abbreviation for coronavirus disease 2019, is caused by a highly infectious and fast-spreading virus, SARS-CoV-2, that is transmitted person to person through close contact via respiratory droplets. Spread may also be possible through contact with contaminated surfaces or objects. Symptoms and their effects can range from mild to severe and result in extreme health complications and even death. Positive cases have been identified in communities across New Mexico. State health officials continue to test, process, monitor, and track instances of the virus. The state of New Mexico has taken proactive, aggressive public health action to reduce the spread of the disease. In this presentation, we provide information to help protect yourself, your coworkers, your passengers, and your loved ones. This presentation is for everyone that works for a transit agency: drivers, mechanics, supervisors, dispatchers, managers, and administrative staff. This includes contractors, city, county, and tribal support staff. Everyone needs to be empowered to meet the challenges of preventing the spread of COVID-19. Information provides empowerment. This presentation has 5 components: personal safety, cleaning and sanitizing, safety during operations, safety in facilities, and employee training and support. We further break down each of these sections into specific topics that discuss how transit agencies can help stop the spread of COVID-19. This section on personal safety specifically addresses actions such as hand washing, using hand sanitizer, and wearing gloves and face coverings, all of which can reduce COVID-19 transmission. We also talk about the advantages of driver compartment barriers. As the Center for Disease Control, or CDC, has emphasized, proper hand hygiene is a crucial measure that can help stop the spread of the coronavirus. It's important to wash your hands as frequently as possible. When you wash your hands, do it vigorously for at least 20 seconds with soap and water. Remember to scrub not only your palms, but also the back of your hands, your thumbs, between your fingers, and your wrist area. So when should you do this? Before and after work shifts, before and after breaks, before and after you handle your face covering, after making contact with frequently touched surfaces, before, during, and after preparing food, before eating food, after using the restroom, and after blowing your nose, coughing, or sneezing. There are going to be times that you aren't going to be near water to wash your hands. That's why you need to carry an alcohol-based hand sanitizer with you at all times, and remember to use it frequently. In fact, transit agencies may want to make hand sanitizer available to their passengers. But note that hand sanitizer must contain at least 60% alcohol to be effective against the virus. Disposable disinfectant wipes are another tool we can use to help stop the spread of the virus. You know the surfaces that passengers regularly touch. Try to wipe those down as often as you can. It's a natural instinct to touch your face, particularly your eyes, nose, and mouth. This is how the virus can enter your system if it's on your hands. Maintain good hygiene to prevent this risk. Now we move on to personal protective equipment, specifically gloves for transit employees. Gloves can help reduce the spread of COVID-19 if appropriately used. If you know you are going to be touching potentially contaminated surfaces, you should be wearing disposable gloves. The key point here is after you've touched a contaminated surface, that glove is now also contaminated. You need to dispose of those gloves immediately after the potential contamination. When removing gloves, do so carefully to prevent spreading the virus to your hands. Don't touch the outside of the glove with your bare fingers. Make sure you reach inside the glove and peel it back off your hand. Used gloves should be sealed in a receptacle to prevent the spread of the virus. Another important piece of personal protective equipment is a face covering. First, we're going to talk about face coverings for transit employees. The state of New Mexico made it mandatory to wear face coverings in public. This includes transit drivers and other transit employees that come into contact with passengers and customers. Transit employees must wear face coverings when they are on a transit vehicle, interacting with customers or otherwise interacting with the public. What kind of face covering should you wear? The covering should entirely cover your nose and mouth and fit snugly, but not uncomfortably. You don't want it to restrict your breathing either, since you may be wearing it for a considerable time during a work shift. Use face coverings made of cloth that can be laundered. Laundering kills the virus and allows you to reuse the covering. Make sure you change your face covering at least daily. When you take off the covering, avoid touching the outside of it and place it in some type of a sealed container, such as a plastic bag. Be sure to either wash your hands or use hand sanitizer after removing your face covering. The New Mexico mandatory requirement for face coverings in public extends to transit passengers. Passengers are required to wear face coverings when on transit vehicles, at bus stops, and in public spaces of transit facilities. However, children aged 2 and under are not required to wear face coverings. Also exempted are passengers that have medical conditions that prevent them from wearing a face covering. These passengers should be allowed to ride transit vehicles without a covering. What if someone is getting ready to board the vehicle and they aren't wearing a face covering? Transit agencies should consider strategies to provide face coverings to passengers that don't have one. This might be a resource challenge for some transit agencies, but may be the only way we can assure we're able to provide transportation services to those that need them. Now we move on to barriers to help protect transit drivers. Drivers are clearly in a vulnerable situation seated behind the wheel. What we want to do is identify strategies that will protect the driver by providing separation between the driver and passengers. One strategy is some kind of barrier to protect the driver from the direct transfer of virus droplets from customers speaking, sneezing, or coughing near them. Barriers can be permanent, such as plexiglass shields and sneeze guards, or temporary, such as clear plastic draping. If you use some kind of barrier, either permanent or temporary, make sure the barrier doesn't block the driver's view of the right exterior mirror. Being able to use that mirror is a basic element of safe driving. Make sure the barrier doesn't hinder the driver from easily and quickly getting out of the seat in an emergency. Also, the barrier should not hinder air circulation in the driver compartment. Other strategies to protect the driver include closing off passenger seating near the driver compartment. As a general strategy to help prevent the spread of the virus throughout a transit vehicle, do not have the vehicle air intake set to recycle. You want to get fresh air into the vehicle as much as possible. This could include setting the HVAC on high with the air intake on fresh air, or even opening windows if that's possible. The next component on cleaning and sanitizing focuses on the Center for Disease Control general cleaning guidelines and guidance on cleaning transit vehicles and facilities. To get started, let's take a look at some general cleaning guidelines from the Center for Disease Control. The CDC tells us that coronaviruses on surfaces and objects naturally die within hours to days, and exposure to warmer temperature and sunlight reduces the time the virus can live on surfaces. The CDC also advises that cleaning with soap and water removes germs and lowers the risk of spreading COVID-19 infection. Further, disinfectants can lower that risk even more. The CDC recommends using Environmental Protection Agency approved disinfectants, but if they are in short supply, you can use alternatives. Recommended alternatives include 1/3 cup of bleach per gallon of water or 70% alcohol solutions. Bleach solutions are effective on surfaces for up to 24 hours. Keep in mind that softer porous surfaces may need a different kind of cleaning solution than a hard or non-porous surface. Just remember to use and store disinfectants according to the label, and never mix bleach with other cleaning products. The resulting fumes can be very harmful to you. In addition, wear gloves appropriate for the type of chemical you are using. Based on the product you're using and the setting you're working in, you may need additional personal protective equipment. Now we're going to specifically address the cleaning and sanitation of transit vehicles to help reduce the spread of the coronavirus. It's a good idea to clean vehicles at the beginning and end of each shift, but at a minimum, thorough cleaning should occur at least once a day. Those responsible for cleaning should always wear gloves and a face covering and keep the vehicle doors and windows open for ventilation, unless, of course, you're using a fogger type of disinfectant. Always use wet methods to clean all surfaces of the vehicle. Avoid dry sweeping. That will just stir the virus around. If possible, drivers may want to wipe down high-touch areas with disinfectant throughout the day as they deliver services. Remember, always dispose of gloves properly after cleaning and wash hands and use hand sanitizer afterward as well. Now we're moving on to some recommendations for cleaning transit facilities to reduce the risk of spreading the coronavirus. Transit facilities should be cleaned regularly with water, detergent, and an improved disinfectant. Again, those who clean the facilities should wear face coverings and gloves appropriate to the type of cleaning solution they're using. If possible, conduct cleaning activities when others aren't present. Be sure to pay special attention to frequently touched surfaces, such as door handles and countertops. When cleaning restrooms, keep the door open to allow air circulation. And don't forget to regularly clean the vehicle maintenance shop area as well as tools. And as I've said before, be sure to dispose of gloves properly when you're done and wash your hands and use hand sanitizer afterwards. In this next section, we discuss what we can do to help reduce the risk of spreading COVID-19 during transit operations. This includes the topics of passenger seating in vehicles, fare handling, passenger boarding, as well as passenger assistance and securement. First, we'll address some strategies for how to keep passengers from sitting near each other in transit vehicles. As the Center for Disease Control has been emphasizing, maintaining a distance of at least 6 feet from others can help reduce the spread of COVID-19. To assist in the goal of social distancing, drivers can verbally remind passengers not to sit near each other or the driver. A more stringent strategy is for transit agencies to limit the number of passengers that board the vehicle. Of course, that number will be contingent on vehicle size and configuration. Agencies may wish to block off seats with either tape or signs to indicate which seats passengers should not use. Consider closing every other row of seats or alternate the closing of rows of seats on each side of the aisle. Be sure your seat blocking strategy doesn't create trip hazards or other types of safety risks. Because of these strategies that limit the number of passengers on vehicles, transit agencies may find it necessary to add vehicles to high-demand routes. Our next topic is fare handling and passenger boarding, and some related strategies to reduce the transmission of COVID-19. If your transit agency hasn't already, it might want to consider offering free fare service. If that's not an option, then develop a plan to reduce the interaction between bus drivers and passengers during fare collection. And keep in mind that anyone who pulls fare boxes or counts fares should protect themselves by wearing gloves and face coverings to help reduce the risk of coming into contact with objects possibly contaminated with the coronavirus. Another option to help reduce the risk of driver interaction with passengers is for passengers to enter and exit the bus through the rear side door if the vehicle configuration and fare policy allow. However, this does not relieve a driver from assisting passengers with mobility devices or other disabilities in boarding and deboarding at the vehicle door that is equipped with a ramp or lift. If you are considering a rear side door only boarding policy, there are some things you can do to help minimize confusion for drivers and passengers. Foremost, you need to develop formal procedures and make sure drivers receive instruction on and understand those procedures. You may also inform riders of the policy and what to do if they need a ramp or lift. You may want to conduct outreach to the disability community about the policy. Our last topic in the safety during operations section addresses passenger assistance and securement. Because it is mandatory to wear face coverings at all times in public, it goes without saying that both the driver and passenger should be wearing face coverings during passenger assistance and securement. Transit agencies may need to consider different strategies to lower the risk of COVID-19 transmission during passenger assistance and securement. These strategies could include reducing the time and person-to-person contact when assisting passengers and mandating that drivers wear disposable gloves during assistance activities. The Americans with Disabilities Act regulation does not explicitly require securement systems. Thus, agencies with mandatory securement policies may wish to suspend those policies. However, that does not relieve a driver from the duty of securing a passenger that asks for assistance. We now move on to the safety and facilities section. In this section, we will talk about reducing the risk of COVID-19 transmission in transit facilities. Our discussion will focus on customer safety in transit public facilities and employee safety in offices, shops, and yards. First, let's address what we can do within our transit public facilities to help keep our customers safe. A fairly simple strategy to enhance safety is to communicate with your customers via signs at bus shelters and transfer locations that they must wear a face covering if they want to ride public transit. The signs could also remind them to practice 6 feet of social distancing and wash their hands frequently to protect themselves. But most importantly, they should stay at home if they are sick so they don't spread the virus. If resources allow, consider making hand sanitizer available at transit facilities where it's convenient to do so. And you'll want to shut down any public drinking fountains if you haven't already. Other strategies to consider that may help stop COVID-19 transmission at public transit facilities include keeping doors open where possible so customers aren't constantly touching the door handles, marking off floors with decals or tape to encourage social distancing, rearranging or marking off seats so customers aren't sitting next to each other, and using non-touch trash cans if possible. Remember, those emptying trash cans should always wear gloves. As I discussed previously in this presentation, it's important to regularly clean and disinfect facilities. If you have the resources, you may want to consider cleaning high-contact surfaces several times a day. The last recommendation, developing a strategy to minimize the presence of non-riders at transfer locations to help reduce COVID-19 transmission, may require coordination with local law enforcement. Now, we move on to how we can help reduce the risk of COVID-19 for employees in our offices, shops, and yards. Just as we recommended for public transit facilities, place signs in offices and shops reminding employees to stay home if they are sick, wear a face covering, practice social distancing as much as possible, and wash hands frequently. You may also want to consider arranging employee workstations to promote social distancing, as well as closing break rooms or limiting the number of employees in the break room at one time. In common areas, such as meeting rooms, you can rearrange the seats to help employees maintain distancing. Something else to consider is limiting the number of employees attending staff or safety meetings at one time. For most transit agencies, that will require having more than one session of the same meeting to reach all employees. Another recommendation is to advise employees to take their temperatures before coming to work. If their temperature is over 100.3 degrees, they should stay home. And of course, if an employee begins feeling ill at work, they should immediately go home. Some additional considerations to help reduce the risk of COVID-19 in our offices, shops, and yards include shutting off drinking fountains, restricting access to transit offices by customers or others, using non-touch trash cans, and wearing gloves when emptying trash. Here's something very simple you can do within offices and shops to help protect yourself and other employees. Avoid using or sharing items that cannot be easily disinfected after use. You may also want to develop strategies to help limit close contact between operational employees, such as drivers, dispatchers, and supervisors. One approach is to make sure they stand 6 feet apart when communicating with each other. This procedure should extend to drivers in offices and yards, as well as between mechanics and maintenance shops. You may need to think strategically about vehicle maintenance assignments to help maintain distancing. And I know we discussed cleaning facilities before, but I want to emphasize this again here. Clean your workspaces with disinfectants at the beginning and end of each shift. Wipe down your desk, keyboard, mouse, telephones, and other frequently touched surfaces. Management should make sure transit offices are regularly cleaned and sanitized. The final component, training and support for employees, presents information on the importance of training for handling conflict and de-escalating potentially dangerous situations. We are also going to look at the need to help employees recognize and manage stress. Both these topics are crucial issues in meeting challenges created by COVID-19. First, we're going to discuss training for handling conflict and de-escalating situations and why this might be necessary. The risk of contracting COVID-19 and the need for social distancing and other measures may cause passengers extra stress. This stress could result in conflict between a driver and a passenger, a supervisor and a passenger, or between two passengers. This conflict could escalate into assault. Drivers need to be prepared by learning techniques to defuse these types of situations and knowing when and how to request law enforcement assistance if needed. If the transit agency hasn't already addressed this type of training for drivers, It can find curriculum resources through the National Transit Institute or other national entities. There may well be resources at the local level to provide the curriculum or even delivery of such training. Transit employees are not immune to stress caused by COVID-19 risk. Next, we're going to talk about what a transit agency can do to help address this concern. Because transit employees interact with the public, they may be concerned not only about contracting COVID-19 themselves, but transmitting it to family members. Fear and anxiety about a disease that no one totally understands can overwhelm people and take an emotional toll. Thus, transit employees need information on how they can mentally prepare to work in the current environment. Employees may need information on understanding and identifying stress and burnout. Also, what are some ways team members can support each other during this time? What are some self-care and family support techniques? Hopefully, transit agencies can assist their employees with this information, as well as inform employees of any hotlines or counseling services that are available to them. These services could be a part of their benefits package or free services within the community. The New Mexico Department of Transportation already distributed to transit agencies the CDC document titled Mental Health and Coping During COVID-19. This document provides general guidance on the topic. We hope all transit employees have received a copy of this document. Keep in mind that part of your transit mission is not only to work to keep your customers safe when using transit, but also to make them feel safe in the transit environment. This presentation laid out some basic guidelines to help halt the spread of COVID-19 and its effects through personal safety, cleaning and sanitizing, safety during operations, safety in facilities, and employee training and support. The New Mexico Department of Transportation hopes this information assists and empowers you in the challenges presented by COVID-19. Thank you for all you do to support quality of life in your community.